Let's talk about how to do this. On Lena's examination, we saw a few things that we're going to kind of categorize. So there are parts of her skin that had a lot of redness, and it was thickened and inflamed. That's the core inflammation. A common way to treat it is with topical corticosteroids. It's the most effective, and if you're using the right strength with the right guidance with a pediatric dermatologist, it really can make a huge difference. There are some non-steroid anti-inflammatories, tacrolimus ointment, which is one, and we can talk about that. Not quite as effective, but if you need to minimize the exposure to steroid, that's another option. And then we can talk about natural. There's a couple of natural remedies that can help. Florazone is a biologic plant ingredient that's been shown to be a natural anti-inflammatory. Some people see results with that, so I think that's a good option. And coconut oil actually has been shown to be effective.
And the key is breaking that cycle, right?
And itch, scratch, itch cycle.
Right, so that in a flare, you want to hit it with everything you've got, I would assume, but then on term of a chronic, long-term basis, you just want to keep it manageable and make sure that that vicious cycle doesn't set in.
Dr. Lee, you keep mentioning inflammation, and whenever I have a patient with anything that's an inflammatory process, whether it's asthma or whatever, I often make sure you're not doing anything in that child's life that increases inflammation, even what she's eating. The processed foods, saturated fats,
laundry
those things.
Detergent.
Yeah,
Jim?
right. Make sure you use a low hypoallergenic laundry detergent, because especially the foods, all that stuff will increase just the general inflammation in the body. Kids with eczema or any dry skin problem like this, if they catch chicken pox, it tends to be much more serious. So this is a child that I absolutely recommend has the chicken pox vaccine to prevent that problem.
Yeah. And so, Dr. Liu, you have something you want to tell the family?
Yes. So, Elaine and Gabe, I'm going to give you a specific regimen for Lena. We're going to work on repairing her skin, preventing infection, identifying infection, reducing the inflammation, and giving you some triggers, I think, that have been issues for her.
Thank you so much.
Dr. Liu, thank you so very much.